Welcome to this brief training session on the coronavirus and COVID-19. We all need to work to support ourselves and our families. However, it is vital that no one comes to work sick or is allowed to work sick. This would risk infecting your entire crew or project, possibly leading to major shutdowns. Therefore, there is zero tolerance for reporting to work sick. If you are sick, stay home. If you feel sick at work, go home. If you see someone sick, send them home. Coming to work sick is irresponsible and offensive to your coworkers. Please be respectful and considerate of your colleagues by staying home when sick or leaving work immediately upon feeling the onset of symptoms. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as severe acute respiratory syndrome. In short, the coronavirus causes the disease COVID-19. Hence, COVID-19 is commonly referred to as coronavirus or the coronavirus disease. Despite recent nationwide complacency towards COVID-19, the virus is still very much a threat. In fact, many states, such as Arizona, Florida, and Texas, have been experiencing a spike in COVID-19 cases as states continue to reopen after previous stay-at-home orders were lifted. It is imperative that we defeat complacency through awareness and by practicing the preventative strategies discussed in this training video. Please remember that COVID-19 has no cure or vaccine at the time of this training. This graphic illustrates the progress of COVID-19 cases nationwide. As this graph plainly shows, cases of COVID-19 continue to increase at a steady pace. So please do not be complacent and remember that the coronavirus is not only still out there, but a greater threat than ever. This graphic illustrates the cumulative death toll of COVID-19 in the first half of 2020, compared to other major causes of death across the globe. This data serves as a sobering reminder to the fatality of the virus and the necessity of social distancing and wearing a face mask, both at work and at home. When you wear your face mask at work and take precautions outside of work, you are respecting the hundreds of thousands of lives lost by doctors, nurses, first responders, loved relatives, friends, and the general populace. We must all do our part to prevent the continuous spread of COVID-19. Please remember, no matter who you are or where you live, everyone is susceptible to the coronavirus, and no one is immune. As of this training, there is no vaccine for the coronavirus and no cure for COVID-19. Those affected by this virus include world leaders and young children. In order to maintain the health and safety of your coworkers, friends, and family, it is crucial that you take this virus seriously. It is important to note that COVID-19 can affect your livelihood. For one thing, we could be carriers without even knowing it, and therefore unwittingly infect others, including our family members and neighbors. Likewise, if we do not use safe practices at work, we could inadvertently spread the virus to crew members who in turn could bring the virus home to their families. If we become infected, we would have to stay home in isolation, or if there is an outbreak on your project causing the project to shut down, you could lose your source of income. Lastly, you could become dangerously ill, especially if you have a pre-existing medical condition that can be aggravated or lead to complications. Often, people are unaware they have underlying medical conditions, so it is vital that we take all these precautions seriously. It is important to note that not everyone who contracts coronavirus presents symptoms. However, in most cases, symptoms appear between 2 and 14 days after exposure to the virus. On average, it takes about 5 days after exposure to begin to show symptoms. These symptoms include fever, runny nose, dry cough, shortness of breath or trouble breathing, fatigue, body aches, nausea or vomiting, diarrhea, or the loss of taste or smell. Complications from COVID-19 could also include pneumonia if cases worsen. Asymptomatic is a term we hear a lot lately. Asymptomatic simply refers to a sick person who does not appear to have any symptoms or signs of illness. As we mentioned earlier, not every carrier of the coronavirus shows symptoms. According to the CDC, 35% of patients are asymptomatic. They do not have symptoms, but can still spread the disease. Symptoms are typically felt 2 to 14 days from exposure, with the average time being about 5 days after exposure. Because so many infected people do not know they carry the disease and that they are contagious, It is vital that everyone wears a face mask whenever around other people. It is the only way to ensure you are not unknowingly spreading the virus. The transmission of the virus is becoming better understood every day. The virus is believed to spread primarily from person to person, particularly between people who are in close contact with one another within 6 feet. The longer you are in close contact with an infected person, the greater the chance of contracting the virus. This transmission happens when respiratory droplets and particulates are produced by an infected person coughing, sneezing, or talking. These droplets can then land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is important to note that the virus can be spread by people who are not showing symptoms, who are asymptomatic. We will talk more about this in the coming sections. Along with face coverings and social distancing, coughing and sneezing etiquette is another simple way to prevent the spread of the virus. Cover your mouth and nose with a tissue when you cough or sneeze. If you find yourself without a tissue, cough or sneeze into your upper sleeve rather than your hands. Always try to move away from people before coughing or sneezing. Dispose of your used tissue in a wastebasket, preferably one with a lid. After coughing or sneezing, immediately wash your hands with soap and water for at least 20 seconds per the Center for Disease Control guidelines. If soap and water are not available, clean your hands with a hand sanitizer that contains at least 60% alcohol. This graph shows the progression of the viral infection. The word communicable or communicability simply means the time period in which an infected person is contagious and can spread the virus to others. The important information to take from this slide is that an infected person, who may not even know that they are infected, can be contagious 2 days prior to experiencing any symptoms. They can remain contagious throughout the length of their illness. Again, this shows us why it is so vital for every person to wear a face mask, whether they are sick or not. Now we will summarize what we have already learned. First, remember that infected people are usually contagious as early as 2 days prior to the onset of symptoms. They do not know they are infected, but they are still contagious and can spread the virus to others. Second, some infected people will never show symptoms of being sick despite carrying the disease and being able to spread it. Because so many people can be contagious and not even know they are infected, they'll feel completely fine. It is vital that everyone wears a face mask whenever they are near other people. Carpooling is usually something we would encourage, but in light of the coronavirus, it is advisable to avoid carpooling whenever possible. Carpooling can be risky because it places you in close contact with another person within an enclosed space for the duration of the ride. If one of the people in the vehicle is infected, perhaps unknowingly, if they're asymptomatic, they can pass the virus on to the other occupants of the vehicle. It is best practice to avoid carpooling altogether at this time. However, if avoiding carpooling is not an option, it is advisable to wear a face covering and to leave the windows at least partially down for ventilation. So what precautions should we be taking at work? For one thing, all employees are required to wear a face mask. There are no exceptions to this rule. And please note that an employee can be sent home for not wearing a face covering. It should be treated like any other piece of required PPE. Remember, you can be a carrier of the virus without even knowing it. Your face covering is designed to protect your coworkers. Also, remember that social distancing of at least 6 feet whenever feasible is still required even when wearing a face mask. Face coverings are not a substitute for social distancing. You should be practicing both to minimize the chance of spreading the virus. Combined, they are our best defense against the spread of the virus. Recent studies have shown a significant reduction of COVID-19 cases seen in states that implemented face coverings. The rate of new cases decreased and continued to drop after the implementation of face coverings. Conversely, other states that did not implement mandatory face coverings did not show a significant reduction in cases. The study estimates that face coverings may have prevented up to 450,000 cases in those states that implemented the policy. Total confirmed cases in the US currently stands at 2.32 million, with 122,000 fatalities. which results in a 5.25% fatality rate. Multiplying 450,000 cases by the 5.25% fatality rate means that 23,000 deaths were potentially prevented simply by wearing face coverings. As you can see by this bar graph from the CDC, COVID-19 has a far higher mortality rate than the seasonal influenza and therefore must be taken seriously. Starting at age 50, the mortality rate drastically increases, which may not directly affect you, but will absolutely affect someone you know or care about. It's vital that you consider your work environment and the lives of your crew members before making decisions that could put you at an increased risk of contracting COVID-19, which you could then pass on to them. Please note that there are consequences for not wearing a face mask that are much greater than the disciplinary action you might face from your employer for not wearing one. If a craft worker comes to work infected, perhaps without symptoms, and does not wear a face mask, that entire crew, or possibly the entire project, may have to shut down and go into quarantine. To the contrary, the crew and/or project can continue to work as long as everyone follows the face mask requirement. You also potentially expose yourself and your crew members to the coronavirus, greatly risking everyone's health and safety. Additionally, you potentially expose your family and loved ones to the coronavirus. It's important to remember that the face mask and social distancing are the best ways to prevent the spread of coronavirus. Group gatherings, such as safety meetings, need to be conducted safely. The precautions are the same whether they are for daily risk assessments, weekly toolbox talks, or a safety stand down. In any case, do not pass the sign-in sheet around. The crew leader shall note every person in attendance. No signatures are required. Be sure to maintain at least 6 feet of social distancing at all times. And of course, always wear your face mask. Remind your crew leader that the DRA should include discussing the hazards and control measures associated with coronavirus. A common question these days is, should I get tested for the coronavirus? This chart on the right explains what to do in case you are experiencing symptoms. However, there may be times when you should be tested when you do not have symptoms, such as if you have been exposed to a known carrier of the virus. Testing is much more widely available today and can be found at most hospitals, many urgent care centers, most major pharmacies, and even some drive-through centers in major cities. Please reach out to your primary care physician for more information. So what should you do if you have tested positive or are experiencing COVID-19 symptoms? First, notify your supervisor and safety department immediately. Then contact your family physician as just explained. Then, work with human resources and the safety department to identify anyone you may have been in contact with. Please note that all contacts will be informed and monitored daily for temperature. Also note that return to work can only happen after the return to work requirements are met. Those requirements are as follows: no symptoms for 3 full days without the use of fever-reducing medication, or a negative COVID-19 test result, or a letter from a doctor showing employee recovered and safe to return to work. Reporting requirements are as follows. Report symptoms to supervision and to the safety department as soon as you feel them. This is vital for minimizing the spread of the virus. Report if anyone in your household is sick or has tested positive for COVID-19. Report if anyone you have been in close contact with is sick or has tested positive. This can include friends, extended family, etc. Remember that quick reporting is critical to help prevent the spread of coronavirus and to protect our work and home life. Because of how vital this is, there is a zero tolerance policy for failing to report symptoms, illness, or contact with other infected people. Practicing coronavirus safety at home is just as important as it is at work. When doing so, you want to be sure to avoid close contact with people outside of your home, disinfect common touch areas such as sinks, countertops, and doorknobs, keep your hands clean, wear face coverings at all times while in public, and exercise coughing and sneezing etiquette. And remember, most cases of coronavirus are acquired outside of work. High-risk exposures outside of work. This applies to large gatherings such as bars, restaurants, gyms, concerts, places of worship, and other social gatherings. By attending these social gatherings, you put yourself and your family at much greater risk. This is amplified by the fact that many people in social gatherings do not wear face masks or practice social distancing. It is best practice to avoid any place that does not enforce 100% use of face masks and/or social distancing. When visiting essential public places, such as the grocery store, be sure to wear a face mask and practice social distancing. Protecting our families is naturally everyone's top priority. So remember, if you refuse to wear a face mask or take preventive measures, you risk infecting your spouse, children, friends, others in your community, and those in high-risk situations such as grandparents and people with underlying conditions. The accountability is on you to take personal responsibility for protecting your loved ones by following all coronavirus guidelines. This means, among taking the other precautions we've discussed, that you always practice social distancing when feasible, and that you always wear a face mask without fail. Coping with the coronavirus and the limitations it has set on us can be very stressful and emotionally taxing. If you wish to speak to someone about feelings you may be having, please remember that most health insurances offer an employee assistance program to assist employees through challenging times. Contact your insurance company for more information. We encourage anyone who wishes to speak with someone to do so, whether it be a professional or just a friend or family member. Alternatively, you are always welcome to reach out to your safety department and ask to speak with someone there. We are all in this together, and we will all get through this together. Now let's review what we've learned today. There is zero tolerance for reporting to work sick or for staying at work after symptoms present themselves. Coronavirus causes COVID-19 respiratory disease. COVID-19 spreads through close human contact. Talking, sneezing, and coughing near others can spread the virus. Many states are currently experiencing a spike in new cases. Many people who have COVID-19 never get symptoms and do not know they are infected and contagious. For those who do get symptoms, they may be contagious as early as 2 days prior to their symptoms. Workers must report all cases, symptoms, and exposures to supervision, including exposure to sick family members. We must practice the same precautions at work and at home. We are all responsible for taking the necessary precautions to protect ourselves, our coworkers, and our families. Wearing a face mask and practicing social distancing, a minimum of 6 feet, are our best defense against the spread of the virus. Please be respectful and considerate of others by wearing your face mask and maintaining social distancing. There is no cure or vaccine as of the time of this video. We know you are all busy, so we thank you for your time and for your vigilance in following the guidelines discussed here today. You can find more information about the coronavirus and COVID-19 at your state's Department of Health or at the following websites. Thank you for your vigilance and for following these precautionary guidelines to help defeat the coronavirus and the disease COVID-19.